Imbuto Foundation was created by Her Excellency, the First Lady of Rwanda, Mrs. Jeannette Kagame, 20 years ago. When the foundation was started in 2001, it was actually known under a different name called PACFA, or Protection and Care of Families Against HIV/AIDS. So it started as a single project under the Office of the First Lady, looking at the prevention of mother-to-child transmission of the HIV/AIDS virus. So the reason why the focus at the time was put on the prevention of the transmission of the virus was because 20 years ago, the HIV/AIDS crisis was 3 times what we are witnessing today. So the First Lady and a team of very dedicated women went to work and decided to focus on the pregnant women, the mothers who were expecting children, and wanted to make sure that the new generations of Rwanda will not have to deal with the HIV/AIDS virus. So that was in 2001. You fast forward a few years, new programs were being added in education, other programs in health as well, and of course women economic empowerment. So in 2007, as the mission of the foundation was going beyond the prevention of mother-to-child transmission of the virus, the name of the foundation actually became Imbuto Foundation. So we officially moved from PACFA to Imbuto Foundation. And with the change in the mission and the new programs, we started focusing on the education needs of the other siblings in that family, of that young baby who was born without HIV/AIDS. We started looking at the needs of the mother as well in terms of economic empowerment, making sure that she could remain on treatment to keep her HIV/AIDS viral loads at a minimum, actually trying to reduce it until it is suppressed. There was also psychosocial support that was being given to the parents in that family. And in terms of other programs in health, we were also looking at the overall health of other family members. So again, if you picture that child who was born free of HIV/AIDS, who's now going through life, we are imagining that that child has all the siblings who need to go to school, for instance. So we introduced a program for scholarships, and today we have over 10,000 people who have benefited from that scholarship program. We've introduced as well an education program looking at the promotion of girl education, and that program is called Best Performing Girls, where the First Lady travels around the country recognizing the girls who have excelled at primary and secondary school level. In terms of youth empowerment, we were also looking at what kind of support could we give to the next generation of leaders in Rwanda. So we introduced a series of events looking at empowerment through leadership, empowerment through entrepreneurship, empowerment through civic education. The idea really behind PACFA and Imbuto Foundation was to have a holistic approach that followed the life cycle of the different members of the Rwandan community. So the name Imbuto really comes from the philosophy that any seed, like in Kinyarwanda, Imbuto, any seed that is well planted, watered, nurtured will grow into a healthy plant, one that stands tall. And that is the philosophy that Her Excellency, the First Lady, had for the next generations of Rwandans. So making sure that with every initiative that was implemented in the community, the seed was planted and we wanted to see new plants growing up, becoming strong, being able to stand on their own. Whether it was done through the early childhood development programs, where we looked at the early days of a child from conception until 6 years old, looking at the girl education, making sure that she's encouraged to stay in school, she's encouraged to excel, or the young man who just finished high school and is now looking at a career in the private sector, and we wanted to make sure that he felt confident enough. So all those are the seeds of Her Excellency, the foundation, because there is really the belief that with every good deed that you put out in the community will come back tenfold and will influence the next person in the community so they can also stand tall. It has been a very, very impressive journey. From a single project in the prevention of mother-to-child transmission of the virus, a single project looking at the women economic empowerment, to today implementing over 20 projects in the sectors of health, education, youth empowerment, and even looking now at how to maintain the gains of the foundation, how to look beyond the 20 years. We are now expanding to look at the knowledge development and dissemination, where we want to give back to the community even more, and we do so in the form of systematizing the knowledge of Imbuto Foundation, finding a way to package it and share with other community-based organizations or youth-led organizations, so they in turn can take over some of the initiatives that are happening at the community level. We do so because we believe that for full ownership of any initiative, you have to have people from the community who continue implementing them. 20 years for us also means being even more effective in terms of understanding how the ecosystem works in Rwanda when it comes to community work, community empowerment. So it means encouraging even more partnership with people who are already working in Rwanda, whether it is government institutions, partners at international development level, partners from the private sector, really trying to be even more open in terms of who can work with Imbuto Foundation, trying to be, again, a bit more understanding of how the ecosystem works when it comes to the work that we do, like as an NGO. And last but not least, as we're looking at 20 years of work represented all around the country, we are also looking at the financial sustainability of the foundation, and that is how this year, in the 20th year of Imbuto Foundation, we launched a trust fund. Thankfully, the legislation of Rwanda allows us to start a trust fund as a way to maintain a certain level of financial independence that will allow us to continue investing in the kind of initiatives that we believe in, being able to support the community base that we believe in as well. So for the trust fund to be attached to the mission of the foundation, we see it as a way, one, to tap into the opportunities of the government of Rwanda that says Rwanda needs to become a new financial center that needs to attract investment from all around the world. So as an organization that has been working with so many different partners, including international partners, we believe that it's time for us to create a fund that allows us to generate income that would then be used for the different initiatives of the foundation. As a non-governmental organization, I think it is very important for the financial sustainability that you move beyond being dependent on grants and direct support from donors, because there is a lot of fluctuation over the years. We have seen, for instance, that there are moments where the priorities of the international partners shift from topic 1 to topic 2, for instance, but it does not always reflect the reality on the ground for us. So with the creation of this, with the establishment of the trust fund, we're able to say, regardless of what's happening at the international level or the shift in priorities, for instance, we know that sometimes when it comes to climate change, you may actually find that some partners are now more interested in climate change and looking at the progress of Rwanda when it comes to the prevention of the HIV/AIDS virus. Some of them may consider that it's no longer a priority per se. But for us at the ground level, we believe that the prevention needs to continue even more intensively, so we don't see a new spike in the HIV/AIDS crisis. So when we notice that there are shifts in priorities from the person who's giving the money, we want to keep that financial independence to say, it is your money, you determine how to spend it. But us working with the community, we believe that there are some priorities that need to continue to be addressed, some communities that need to continue to be supported until they have reached that full level of ownership, being able to run initiatives on their own, and that's where the trust fund comes in. It gives us this ability, one, to put some money aside, see the money grow, and as we look into the next 20, 30 and plus years of the foundation, we want to be able to say, okay, this is a fund that allows us to now support more intensively certain priorities. It's a fund that allows us to even branch out and look at how do we go into partnership with people who are not necessarily in Rwanda, people who could be at the continental level, really with the idea that Rwanda has opened up to the rest of the world. We have the African Continental Free Trade Area that allows us to have this exchange with other organizations on the continent. So why not be able to actually fund initiatives, all around, beyond Rwanda? So it's really, we see it as a growth as an ability to maintain ourselves, the impact that we have, and again, I insist on the financial sustainability part. I think some of the most outstanding challenges definitely come down to the history of our country. Imbuto Foundation or PACFA was created a few years after the genocide against the Tutsis. And as you can imagine, there were many priorities. There were priorities from an education standpoint, priorities from an infrastructure standpoint, and health. So for the foundation and the team of the First Lady to be able to pinpoint this one item of the prevention of the HIV/AIDS virus from parents to children was key. And we really see it as a big challenge in the sense that they had to be very strategic with the means that they had and be very clear about the vision. So the vision that was there in 20 years ago was saying, okay, Rwanda has gone through terrible, terrible times, but we believe that we deserve better. We believe that the next generations of Rwandan should have access to a dignified life. And with this vision, the organization PACFA and then Imbuto Foundation had to be very, key about, okay, we see all these challenges, so let's go at the level of the seed. That person who's going to grow into tomorrow's leader. Let's focus on that one person. What are her needs or his needs? How do we respond to it? And then how do we become more effective so that we also don't get too, into too many things at the same time, because then the impact may not be perceived the same way. I would say 20 years later, what are the challenges? To some level, we have to say that we have to be grateful as well, because the context of Rwanda has changed over 20 years. The economic development is not the same. It has greatly improved. Yes, we have had to deal with the COVID pandemic that had a terrible toll on our economy, but you're seeing things recovering slowly and slowly. So in terms of challenges, we want to continue being very strategic in terms of the priorities that we want to support, because we cannot go into everything else. But where we don't go into everything else, we want to be at least able to say, let's act like a bridge, because we have access to such a great network. We are exposed to different people who want to do different things in Rwanda. Can we act as a bridge? If Imbuto is not able to tackle this specific issue, do we know somebody else in the community who's able to do it? And if we do, now we believe it's our role to connect the person who has the funding to do so, if the person has the capability to do so on the ground, so that we also feel like not every challenge will need to be answered through Imbuto, but we can act as a convener of different forces. We cater to the entire Rwandan family, from the newborn all the way to the adult, the parent who lives in the home. We acknowledge that girls and young women have very specific challenges that young boys do not have to deal with, but we believe that for any initiative that is going to be sustainable and bear fruits, needs to involve everybody, not just the girl, but also the boy. So if I give an example, we have been working heavily in sexual reproductive health for adolescents and young adults, because we believe that if we were able to contribute to the prevention of the HIV/AIDS virus in Rwanda, it will be from a young age. It will be very unfortunate that once they become adults, those children are now exposed to the virus in another form. So we were saying we can't just address the women. We need to also speak to the young men in the community. So with the sexual reproductive health program, for instance, we speak to both. We handle discussions with parents, what we call parent-adolescent communication forums. We try to engage young men as much as possible on the concept of positive masculinity. In our program dealing with early childhood development services, so we actually welcome young kids under the age of 6 years old, both boys and girls. We work with the parents because there needs to be an integrated package that looks at what every child needs to grow up. So of course there is positive parenting, there is health, there is healthy nutrition, there is cognitive stimulation, because we want the child to maximize on this period where the brain is developing, so the kid is ready to go to school and do even better. So I would say that because we do focus on the entire family unit, our programs are not just geared towards girls. If anything, on the 20 and plus project we've been implementing over the years, I believe only 2 or 3 have been strictly for girls. Everything else has been for both boys and girls of different ages. We want to remain ambitious. We want to believe that the vision, the clarity that drove the First Lady to start PACFA, to continue working today and seeing the foundation grow from a single project to several projects, looking at the holistic development of the entire family in Rwanda, needs to stay alive. But at the same time, we also realize that just like a child who's growing up in a family, when you turn 20 and you start looking towards your future, your priorities change, your responsibilities also change. So we believe that now responsibilities need to shift progressively away from implementation and now more into strategic planning. And we see that happening by being, I want to say, a bit more selective in the kind of initiatives that we support, because we believe that they are community-based organizations in Rwanda who have been growing over the years, that are very strong. And we believe that if we have been able to maintain ourselves for 20 years, there's a certain level of knowledge we have acquired that we owe to the next generation of organizations to also acquire. So we are now looking at this knowledge development and dissemination for the community-based organization, but also looking at the model of Imbuto Foundation, the holistic model following the life cycle of the family in Rwanda. And we say, is this a package that can be shared with other individuals? Could it be used, for instance, at university level as a course to understand how you actually create sustainable impact in the community based on the case studies that Rwanda has had and that Imbuto has contributed to, for instance. Again, in the future, you can't picture your future if you don't picture the entire ecosystem that's around you. So with this ecosystem, we have to be, again, even more effective when it comes to the partnerships that we establish, understanding that we have newcomers in this journey of development in Rwanda. How do we work better with these new organizations that have come, that are coming up? And as mentioned previously, when it comes to the sustainability of the foundation, any organization that can generate income for itself, so they are not as dependent to the shifting priorities that we see around the world, needs to look at what opportunities are available in Rwanda, what does the legislation allow in terms of financial management, because again, there are many avenues that the government has made available for us that we should tap into if we do want to stay afloat and if we do want to continue growing and have even more impact in the next 20 years. As a team, I believe that we are definitely driven by the vision of Her Excellency. We are definitely driven by this great sense of privilege to be able to work in the field that we are working in. And we are definitely driven by the fact that we do see the impact happening. Anybody who has worked with Imbuto Foundation, who has been a beneficiary of Imbuto, or who's had any kind of interaction, can really share that we see the result. If you go into the community today, you see people will tell you, okay, yes, I know Imbuto Foundation. They came, some of them will say they pay for my education, and today I'm at this leadership position, either in government or in private sector. This other person will tell you how Imbuto Foundation helped them again understand the concept of sexual reproductive health. We have had parents tell us that they felt more comfortable discussing sexual reproductive health with their adolescent or the young adults in the family because they received this message from Her Excellency that it was okay to discuss about this, that it was actually for the well-being of the family. So I think there is definitely a great sense of privilege, a great sense of responsibility, because we know there's a huge force that's pushing us. And of course, you cannot ignore that we do not work outside of a framework. So we are very fortunate to also be working in an environment where the government of Rwanda has put in place so many policies that allow us to do the work that we do. So we literally just plugging into an already existing framework that says all these things are here for the community empowerment, tap into it and get to work. On the 20th anniversary, we were very fortunate to have been working with the PACFA Foundation, which is a foundation that donated to Imbuto Foundation 2 mobile clinics. And these mobile clinics will actually be put into use by the Ministry of Health through RBC, or Rwanda Biomedical Center. So those 2 mobile clinics will actually be geared towards doing different testing services within the community. So we're talking about diabetes, high blood pressure, of course, HIV testing as well. But it's also going to be a mobile clinic that will allow people working in the health sector to raise awareness about non-communicable diseases such as cancer. So to increase the need in the community to get checked for the early signs of cancer. So those 2 mobile clinics were given on the day of the anniversary of Imbuto Foundation. Again, it was a donation made through the PACFA Foundation, through Imbuto, to be given to the Rwanda Biomedical Center. And we can't wait to see, again, all the numbers that will come through the mobile clinics with people, having access to now, again, service that's closer to the Rwandan communities.